This conference will now be recorded.
Good afternoon, everyone. Thank you for joining us for our weekly board chair check-in and update meeting. My name is Wilmarie Newton, and I will be moderating this call. I ask that you please mute yourself in order to avoid background noise while the presenters are speaking. However, you can unmute yourself if you would like to ask a question, or you can type it into the chat box. If you are calling in from your cell phone, please take a moment to physically mute your cell phone, as I am unable to mute you from my computer unless I mute all participants, and therefore will not be able to unmute you after. Just as a reminder, this meeting is being recorded and will be archived on CABE's website under Services. Bob?
Hi, everybody. I'm Bob Rader. I'm the Executive Director of CABE. We have a special treat today, and we're going to start right off with Dr. Rich Melchreit. Now, Dr. Melchreit just spoke to the superintendents together with the commissioner and was very helpful. As you know, we're trying to make decisions, and we'll certainly talk about executive orders, the Reopen Education Subcommittee, what's happening with the regional advisory teams. But I know Dr. Melchreit has to go by 2:30, and certainly the decisions that are being made at the upper reaches of the state, including by the governor, are based on the medical knowledge and what we know about the virus. So Dr. Melchreit is from the Department of Public Health, Infectious Disease section. And Doctor, I will just open this up to you. And if we see questions, we'll certainly ask you. And again, as Wilmarie said, they could either be in the chat box, or probably if somebody emails them in to me, I'll try to get to all of them. But with that, thank you so much for being here, Dr. Melchreit. And please begin.
Okay, sure. Well, thank you. It's nice to be with Bob and all the rest of you, and appreciate you giving me some of the time. I'll give you a little discussion. I kind of started off the meeting with the superintendents, with giving them a little background on me and maybe a couple of thoughts from the epidemiological public health point of view that might be useful when you're thinking about. I know the hot topic right now is high school graduation, and but certainly obviously it applies to this viral pandemic in general, and I know very significant and very difficult responsibilities. I know that you always have very significant and very difficult and heavy responsibilities, and that's only magnified several times by this pandemic. And I really want to send my appreciation to all of you for everything you're doing. I know it's hard. So who I am. My name is Richard Melchreit. I'm a physician. I'm a pediatrician by training, and I was in pediatrics for a couple of years. And then about 30 years ago, I moved into public health and have been working in the Department of Public Health in different roles in the infectious disease area, and mainly in the infectious disease section itself, reporting to Dr. Matthew Carter, the state epidemiologist. I retired about 2 years ago or so, but I've come back as a medical reserve corps volunteer, working in the state health department infectious disease section. And Dr. Carter asked me to be a liaison to you, the State Department of Education, boards of education, superintendents, and other interested parties dealing with educational issues, which we know are significant and complicated and very important. One thing, as I said this morning, and I think Dr. Fauci put it very well, we're public health people, we are physicians, epidemiologists, and so in that kind of role, I'm a resource to you, I hope, to give you what my knowledge is at this point in time with this virus. And the virus we're learning, all of us are learning a lot about quickly, but there's still much to be learned. So I'm there as a resource for you, and to maybe answer your questions, or maybe to work out, questions or things you have want to hear about from an epidemiological point of view, recognizing you or policymakers have to deal with many interested parties and many other factors you need to also build into your decision making.
Doctor?
Seems like we have some feedback. I don't know, is that? I'm hearing myself.
We're getting some feedback. So if you're on your cell phone, can you please mute yourself? Our speaker today is on a cell phone, so I can't mute everyone. Otherwise, I will mute him as well.
Okay. Okie dokie. Anyway, as you heard, there's a commissioner's, there was a memo from the State Department of Education and from the State Health Department went out last night, I believe, about high school graduations, which is the kind of the issue most urgent issue that you're faced with right now is what to do about high school graduations and how to do it safely. So that I think you probably all received that, and basically just want you to know that I'm not on those decision-making bodies that work with the commissioner. Dr. Carter and others are working on those. The committees, I think Bob is involved with that, as he was saying. So what those committees are doing are trying to get input from a variety of points of view, including CABE, educators, other interested parties, I'm sure parents, and the public health people to try to work out things and come up with decisions. And so that's the current guidance is that for kind of meetings, like for celebrations and those kinds of get-togethers should be no more than 5 people should be together, and that includes social distancing. So that went out yesterday. I think hopefully it is of use to you. It seemed to be very helpful to the superintendents based on their feedback during the call earlier today. I think one thing that is behind the governor's orders and the planning around reopening Connecticut or anything else we're doing in this era of the pandemic is the science and the biology of this virus. So that's what's really that's behind any advice I can give you is our best understanding of how this virus behaves or other viruses like this behave to try to understand what the risks are and the consequences of viral infection, and then also how we can be safe and how we can continue to function in society doing very important things like high school graduations to the extent we can, or how we need to configure those things so we can function as a society during the pandemic. One thing to keep in mind is, what we've done, and you've heard about, I'm sure, the idea of, kind of reducing or flattening the curve, reducing the peak of infections when this epidemic really hit us in March, April. One of the effects of that is that you're going to have, you always have once you've hit the peak and starting to go down, as we're beginning to see in Connecticut and other places, is you are going to, maybe you'll flatten out and then numbers of new cases will start to decrease over time, but we're going to have a long tail to that wave. It comes up hard at the beginning, and then there's like a longer tail where there'll still be a good deal of infection in the community, which could, when we start to loosen up from our stay-at-home policies, can start to create new clusters, new outbreaks, and perhaps even a second wave. The other issue is in the fall, coronaviruses tend to kind of be seasonal like influenza. And in the fall, there's a decent chance that in Connecticut, we'll be seeing not only our seasonal flu coming in the fall and the early winter in its annual kind of rise, but that we may very well see a comeback of the coronavirus because it has that seasonal quality to it, like flu. So something to be keeping in mind for planning. Other states have been looking at this issue, and getting ready for this call and the call of the superintendents, I did a kind of a spreadsheet which kind of summarizes things I've seen, some I think a proposed plan from parents and students in the state was in there, and I decided to kind of see what other states were recommending. And so I think you got that in your attachment. That's basically research I was doing for myself to kind of get up to speed a little bit on this issue, and I'm just sharing with you since for your interest. One thing to keep in mind is, I think it's very important, and is to always make a point for folks, is that the State Health Department is available as a resource, but we work very much in partnership with our local health departments in the state, and that there would be an important group to be thinking about when you're doing planning around things like high school graduations, especially in this situation, would be, and they may be very helpful in the as you go through implementation of whatever you're going to do, as well as planning. And then, of course, public safety, police are another important group to remember to connect with. I probably don't need to tell you that, but I think it was quite, it definitely came out when I did my review of state guidelines from around the country, the importance of those local resources and partners. I think to kind of finalize what I'm saying is, well, no matter what advice I give you or what you hear, or in terms of your planning as policymakers, always keep in mind this is really going to be driven by the virus, we need to make plans and be ready to revise our plans going forward if need be, because the virus and the epidemic may show us certain things. It may start, like I said, start going away and then show up again. We may have to be ready to institute, social distancing more aggressively if that happens, if we start to see clusters. And public health departments will be doing, I think, as we get to the point that we can really tamp this thing down, we're already getting ready to do this, is to initiate contact tracing and quarantine and isolation of infected people if we start to see new clusters showing up. Once we've gotten the number of new infections down to where very old but very effective public health activity can help us try to keep the future infections under control. And at the height of the curve, like a few weeks ago, that was just not possible. That would have overwhelmed that public health intervention. But as we get further, that we will need to be doing that. And when people are having things like public get-togethers, just be aware that we may need to access you if there's a cluster and we see that maybe people were going to the high school graduation. We may need to be coming to you to say, well, we're doing an investigation and we need information about who was there and things that you might know. So just to be aware that your record keeping will be very important going forward, who is participating, what was done, and so forth, so that if we did need to come to you during a public health investigation, if we started seeing a resurgence in with clusters in the summertime or later after your graduations, that you're kind of ready to see that might happen. We might be coming to you, the public health people. So I think that is it. I'm happy to be here and definitely very happy and willing to continue to dialogue with you or be a resource for you as you go forward with the very challenging work that you're going to be doing. So with that, I think I will end my comments.
Great, thank you, Doctor. I'm waiting for anybody who has questions. Please write them in the chat room. Doctor, I'll just ask you, can you talk a little bit more about the graduation information that came out yesterday? Certainly when our committee, that's the subcommittee of the advisory group, recommended it, we obviously had to go through the medical people to make sure what we were going to plan is safe. There are 3 different examples of what school districts can do. And I was just wondering if you'd like to talk more about that, because I know it's on everybody's minds.
Sure. I think one thing to keep in mind also, and one thing I meant to say, and I didn't, was I just in my remarks, that, what we're talking about is using things like, basically case counting, looking for infections, and then doing follow-up to see if, these clusters, to see who might be getting exposed from whom, and then trying to, tamp it down through isolating people or asking people to go into quarantine. Isolation means you're in the, you kind of stay away from other people and you have the virus. Quarantine means you stay away from other people and you don't have it yet. You might be in the incubation period. Testing is a big part of our investigation tools. So, having ready access to testing is very important. And as you know, there's been a lot of discussion about that on the national level and the state level of needing to have more testing. So our ability to tamp down any new clusters that come out as the number of viruses infections start going down will depend on people to do the contact tracing, to get the data and information from people, and to be able to test individuals that might have been exposed. Ultimately, all of that can help us a lot in keeping this epidemic under control, or getting it under control and keeping it there. Things obviously got away from us this spring. What we're trying to do is prevent that from happening in the fall. Not to say we're going to be 100% successful. There's a decent chance we won't be successful. But maybe we can blunt it, and that's as much as we can blunt it, that's what we want to do through things like contact tracing and testing. Ultimately, to really get back to so-called normality, unquote, quote unquote normality, to have like the traditional graduation where everybody gets together and is in close quarters, you're really going to be talking about having a vaccine available, a safe, effective vaccine that is widely widely available, and then widely used by people. We're not there yet, as you know. There's much discussion about that. That's not happening in the near term by any stretch. So, whether it's going to happen after the first of the year or in another many months or year or later, we don't know. We'll find out as we continue to work on vaccine. Vaccine will get us back to normality. We're not going to be there. Even having a ceremony, as you see in the memorandum, is not going to be your typical normal graduation. So basically, what the fundamental thing about the memo is that under Executive Order 7X, basically social recreation gatherings should not have more than 5 people. Now, those 5 people should still be 6 feet away from each other, but what it means is what they're saying is epidemiologically, the more people in proximity, even with some social distancing, you're increasing your chance of having people passing the virus person to person. One of the most important things you can do is wear masks. So in the various examples we talk about here, when people are out in these settings, they really need to be wearing masks. That keeps the virus, their saliva, the little droplets of saliva from sneezing, coughing, or even talking next to their own face. That's what the mask is for, like the cloth mask or the surgical mask people now wear when they go out in public. So that is part of this picture. But that's why they want to keep the number of people anywhere near each other down to a minimum. And depending on the future, if there's another executive order downstream, if the virus is under better control in a month, 2 months, 3 months, 4 months, you may very well see an executive order that starts to loosen that up. For the time being, Executive Order 7X is still in force, and so therefore, that's the context for any of these social get-togethers, including graduation. So these 3 examples relate to, actually, I think, fairly nicely, if you look at the spreadsheet, what some other states have done in terms of keeping the people down to 5 that are actually out near each other, but that there's a heavy use of either, the most safest thing would be have a totally virtual graduation, and I think there's an understanding that that's hard. It's hard for a lot of people to feel comfortable about that, but it is, I think, example 3. It is a lot of states are doing that. That's what they require. Other states say that examples 2 and 1 are possible approaches, and those are what you see here in this memo. Using like drive-through or drive-in ceremonies, maybe a hybrid of maybe a lot of it is filmed and taped, like maybe speeches to keep it brief, the less exposure everybody has to each other. And then the only time anybody really gets out and moves, maybe leave the car, would be the graduate only, and the graduate might go to pick up their diploma, to be seen in their cap and gown, to be photographed, etc. There is, I think, a strong emphasis, though, even if you're doing that, is to have good monitoring. If you are going to have a bathroom, it really needs to be monitored. If you're going to have anybody out of the car at all, it needs to be monitored. You could pass the diploma through the window. That would be maybe even safer than having somebody come out, go up on the stage and get the diploma. The idea is to keep those virus particles away from everybody, to keep that saliva away from everybody. And anything that does that is going to be protective. And you're always trying to get a balance. I know the safest thing by far would be perfectly virtual graduation. These other things are less safe. But we believe epidemiologically you're going to be significantly decreasing the chance of passing from person to person. The one thing is, no matter what the guidelines is, everybody has to understand that. All the graduates and families need to understand that, and then follow it carefully, whatever you've decided. Because if people break protocol and get into a group close together, which I know in the press, especially during a very significant emotional time, like a ceremony, can happen, that could be problematic and could potentially transmit the virus. The other thing is to keep in mind, of course, is that you really have to be careful about vulnerable people, older people, people with underlying medical conditions, and even if you do have a kind of a hybrid or maybe an in-person, like example 2 or 1 in-person aspect to your graduation, that it would be highly recommended by most of the states to have virtual or have a live stream or a kind of approach where somebody can see it on film either before or after the ceremony, so that those who can't be there, really shouldn't be there, have a chance to participate, or at least see the ceremony.
Doctor, let me ask you something, and I know I'm getting a bunch of questions at this point. Has contact tracing been begun in Connecticut yet?
Not out in the community. What's starting in Connecticut is we've been hit very, very hard in our nursing homes. And so what they've been starting to do in our nursing homes is something along that line. They started off with contact tracing. They stopped that when the epidemic really took off. But now we're kind of instituting what they call cohorting, where nursing homes we're kind of prioritizing, because you can't do them all at once. There's 215 of them in the state. But we're priority nursing homes. We're testing everybody, and then moving people from into one wing or the other of the nursing home, where they have COVID or they don't, to try to decrease the transmission among the groups of people, the residents in the nursing home. So that's where it's really starting, but I think we're planning and anticipating eventually being able to do it out in the community. But exactly when that can start, don't know, and it will depend on the continual progress in decrease of the virus.
Thank you. Mike Porcaro, you said you had a question?
Yeah, thanks, Bob. Hey, Rich, Mike Porcaro, it's been a while since we've worked together. First and foremost, hey, congratulations on your well-deserved retirement, and glad to have you back as a consultant for the state. They just can't let you go, and that's a good sign. So I'm wearing a couple different hats: town administrator, emergency management director for Vernon, also board chair of education in Ellington, and vice president of government relations for CABE. I'm going to push you a little bit more just on some of the guidance that was shared by the commissioner yesterday, and that you just shared as well, if you don't mind, Rich. People are looking for specific information. on what we can and can't do. And we want to do this in sync with the current executive orders and, of course, with the utmost concern for public health and safety. But we also want to balance that with what's possible and what's not possible. So if I heard you correctly, and as a point of clarification, we do have available to us the hybrid model within the public health guidance to do a live in-person thing. And that may mean more than 5 people are going to be in an area, but it just has to be socially distanced apart within their vehicles and so forth. That's a question that many of us are getting in our leadership roles. Is on one hand, we're hearing it can't be more than 5, but I want to make it clear for everyone listening in and for all the questions that I've gotten, everyone else has gotten. You can have more than 5, but it's got to be within the guidelines. Second question, the commissioner put out, you have to have local public health approval. Can you please describe what that should look like? Is it more you have to work with your local public health director, or is the state saying submit a plan, it has to be physically reviewed, signed off on by the local public health director? Any additional guidance is appreciated. Thanks, Rich.
Surely. Let's see. Yeah, in terms of the 5, I mean, that would mean, for instance, let's say you had, first off, it doesn't mean you can only have 5 cars. Let's say you're going to have like a drive-in. I know one superintendent was talking about something that sounded like a drive-in movie, where you would have maybe 80 cars in an old drive-in movie theater. But what that would mean, only 5 people could be out of those cars, like up on the stage at the same time. That would be the equivalent of what we're talking about, and keep those 5 people away from, 6 feet away from each other. So it's, I think, and a lot of that could be, the hybrid could be like the speeches, again, to keep the amount of time people are in contact with each other, the speeches and all that, maybe that they could be filmed ahead and projected on the movie theater screen, so that actual person-to-person contact would be up on the stage. Nobody's touching each other. They're all 6 feet apart. They're all wearing masks. And the graduate comes up on the stage, walks across, picks up their own diploma, or mail the diploma to them. That's the other possibility. And maybe there's a photographer who's one of the 5 people who photographs that young person as they go, and they've gotten recognized. Now they go back into their car by themselves. So that's the 5 people. It's, but you could have, you're in cars, you're not going to be, you're not a risk to each other inside the car. Out when car to car. So car A is not a risk to car B. Recommend people keep their windows up if possible, and they won't, and maybe keep the cars, as some states do. Some states say keep the cars 6 feet apart. That's fine. But I think being inside the car, you're kind of isolating yourself from the other cars. And so I think that's that one. In terms of approval, it's what's written here. I think we may have to check with the Department of Education. What I see here written here is consistent with what I was saying. Is highly recommend that you touch base with your local Department of Public Health, and your police, to go over what your plans are, to get their expert input into that, and see, what, if any, role they may be playing and working with you as you're putting this on. But I think that's my understanding. I think if there's any questions, it would certainly be good to bring to the Board of to the State Education Department, and I'll happy to consult if you have specific questions as you do your planning and you're saying, okay, we have this written down now. We really like somebody to look at it. I mean, I think we'd be happy to do that. And again, I think your public safety and local public health people could also, I imagine, would be happy to do that, I suspect.
Thank you, Dr.
There was no discussion at the subcommittee, Mike, of the State Department having to go through all of them and approve them. It was just, we put out these, we added the examples so people had an idea of what was possible, but we didn't need prior approval from the State Department. Doctor, you have time for one more question?
Yes, surely.
Okay. Can you talk a little bit about masks? We saw a study that showed it was going to be very, very expensive, and that it would be better if the children brought masks to the schools. Do you think that's reasonable, and do you think that would be in the best interest of everybody? I hear questions all the time about how are you going to make 5, 6, 7-year-olds wear masks all day. So wherever you want to take that, we'd really appreciate it.
Okay, so this is kind of going forward towards maybe summer school and fall school.
Sure.
Commissioner Cardona mentioned on the superintendent call earlier today that the governor's, council and advisory groups and committees, I think, Bob, you're involved with that, of course, are actually working on some protocols. And so you should probably see that sooner or later. So stay tuned. In the next few days, you may be seeing something related to summer school. And those issues would be coming up there if there's any kind of interpersonal contact. But again, it may be as well be virtual, in which case that's not an issue. Going forward towards the fall, and again, this planning is, I think, is starting. As you just probably heard on the news, some of the federal plans from the CDC have just come out like last night. That could be helpful to people thinking about what to do in the fall with school. I've looked at those. It's very slim. There's not, it's nowhere near as detailed as CDC normally puts out. I think there is much more detailed protocols, but they were not released by the federal government. So we'll see what happens with that. I think I have a feeling we'll probably need to be seeing what other states do in terms of planning. And I think our governor's process will be very, very helpful here in Connecticut to have that kind of input from our in-state experts. In terms of in hospitals, for instance, we recommend that children above age 2 wear a mask in that kind of setting. And I know that that's just, maybe they may not be in the hospital all day long. It will, I think what we're going to need to do is obviously have some level of flexibility, at the same time recognizing that you do best when you have everybody masking. Because like I said, the mask keeps the saliva from your nose and mouth on your against your face. If I take off my mask, I'm not protecting you. If you take off your mask, you're not protecting me. When we both wear masks, we're protecting each other. So these are the surgical masks. N95 respirators, like they use in hospitals, is a whole nother animal, which I won't digress into that. But I think what we'll probably end up seeing as we kind of work this out, it's something that we need to have obviously a lot of discussion about, is to see how much masking we possibly can maintain going forward. It's speculation to say what the policy will be right now. I think we need to do a lot more work on this. I think the fact that you're bringing it up is a really good one. I think that's should be an important part of the discussion. Not assuming, and again, I'm a pediatrician, they're not assuming that kids are going to be able to wear a mask all day long, morning to night. So we got to kind of work on that.
Thank you so much, Doctor. Sorry you have to go, and sorry we are on a fairly tight schedule, but we very much appreciate you talking to us today. If anybody has other questions, please email them to me or Patrice. The names and the email addresses are on the screens. It's rrader@cabe.org or pmccarthy@cabe.org, and we'll try to get them over to the doctor or somebody from the Department of Public Health who will be able to help us. So thanks again, Doctor.
You're most welcome, and best of luck to all of you. Thanks for everything you're doing. Really appreciate that.
Thank you, and for what you're doing. Okay, so next, we want to talk about executive orders and SDE action. I'm going to turn it over to Patrice at this point.
I think I should be very brief in the interest of time, because I know there are a number of other things on the agenda and people that would like to make some comments this afternoon. I think the biggest SDE action this week was the release of the graduation memo. A number of districts had already started to move ahead with plans. Many of those plans that I've read about appear to be in conformance with the guidance from the Department of Education. It is anticipated that the guidance on summer school will come out either perhaps this weekend, if not very early next week. The Department of Education has sent it on to the governor's office where it has to be approved before it's released. In terms of executive orders, there was clarification this week around the issue of voting for regional boards of education and other votes that would normally take place in elections that would normally take place in May. Rebecca, do you want to briefly describe that timeline that's been extended?
I'm sorry, Patrice, I was having technical difficulties. Can you just give me which one you were talking about?
The regional, the voting for regional officials and the extension of the timeline.
Got you, absolutely. Sorry about that. So what they've decided to do is to hold elections for what would normally be done at a town meeting or that gathering in May, and you are to hold off until at least July 15th, but you must conclude those elections by the end of August. And they said the end of August, and then someone said August 30th, but I think there's a 31st. So I'm just going to say the end of August.
Thanks, Rebecca. Back to you, Bob.
Thank you. Thank you. Moving along, the Reopen Education Subcommittee, we have gone to 1.5-hour meetings 3 times a week. Commissioner talked about it yesterday in some detail about what we're doing. We have focused mostly on summer school. Before that, we talked about what will happen to the rest of the school year. But we are hoping that summer school will give us some answers to the best way to do certain things. We talk about buses, we talk about resources, equity, the mask question, all the questions you might think of. And we're trying to come up with recommendations that on I guess a lay person who doesn't know much about the medical issues, somebody like me, tries to give the best advice, and then it goes up through the guidance committee. The guidance committee is really made of the medical people. And after that, it goes to the full Reopen Advisory Committee. And then the governor makes whatever decision he's going to make anyway. So it's a bunch of groups, not unlike the regional advisory teams that are providing guidance that we're working off of, that I supply to the subcommittee, and then it goes up. Just moving on, because I want to give you folks a chance to speak. I know the advisory teams again met this week. We're going to send out in the next few days a list of all the people who are on them. We have some wonderful people serving on those advisory teams who come from school boards and are getting school board input. Like everything else, there's a lot of uncertainty, a lot of difficulties. Some people think that it's going to be very, very hard to open up in September. Other districts, other people think that, well, let's see through the summer where we're going. And I think overall, there's a feeling of we're going to do the very best we can for our students. Certainly, 2 of the priority groups are the special education students and the EL students. In addition, those who have lost the most over the summer. We know that some of our districts have a number of students who have been disconnected since school started. And I don't just mean those who are listening and disengaged. I'm saying they're not even listening because they can't get on because they don't have a computer or some kind of access point. So with that, I'm going to turn it over to Patrice again, who's going to talk about concerns or successes you might have that you can share with us.
So this is really the opportunity, and we're going to try and do this every week, to have you frame a conversation around a concern or even better, a success? What's something that's working well in your district? Have you been able to overcome a certain challenge? Something that you're proud of or grateful for in your district? And I think both Don Harris and Mike Picaro are on and did want to make some comments. So I think this could be an opportunity for you to do that as well.
Yeah, I am on. But before I get to that subject, I really wanted to kind of weigh in on the regional advisory teams, or RAT as they are commonly referred to.
Lovingly.
Interesting acronym. Because I have made a lot of phone calls over the past few days, and I'm concerned that conversations are headed in the direction of we're probably not going to be able to open in September, may not be able to open for the rest of the year. And that conversation is really bothering me, although I don't ever want to put kids in jeopardy. But for our average, our below average, our special needs children, distance learning is not absolutely doing it for them. They need that one-on-one. They need that special treatment. And I'm just wondering, are people getting very comfortable in this distance learning or staying at home and maybe figuring, I'm just not sure. I kind of would like to hear what are some of the comments out there. I know Chris Wilson, and I talked to him earlier today. He's on that CREC advisory team, and I'm concerned. I'm concerned. I just want to know what the rest of you are thinking.
Bob, this is Andy George. I'm the representative down here, the board representative down here in the CES territory. In our discussions, there are a lot of points that have been raised, but there have been no recommendations really coming from the regional advisory team regarding openings. So, I mean, again, concerns are being raised, and a lot of the questions they're almost becoming repetitious because these are concerns that people have expressed over and over. But I have not heard, at least in our meetings, anything about not being able to open in September. I mean, obviously concerns, if we have to have social distancing, that, for a school district like ours in Stamford, that would be extremely difficult. But still nothing about not opening.
Andy, the only thing I'd say to that is when you see that one of the two major California university systems already decided not to open in the fall, and the likelihood is the Caltech system is going to follow them, and probably the New York university's system. When you start to see university system after university system decide fall isn't going to cut it, my guess is it's probably reasonable to assume we may be in a similar position. I'm Greg Cava, by the way. I'm the chairman of the Region 12 Board of Education. We were lucky because we had already had we had devices in the hands of every student from grade 2 up before this hit. And within a weekend of it hitting, we had the devices in the hands of kindergartners and first graders. We had a robust distance learning thoughts before this. Because we were trying to cope with the idea of what would it be like? Is there any possible way this could be done? Now, obviously, had they not relaxed federal and state education requirements for special needs kids, we wouldn't be able to do this at all. But now that we're doing it, we're finding in Region 12 that it's at least reasonably effective as it can be when you've cut down the instructional time to basically half of what it used to be. We're finding some special needs kids who maybe have associational issues or whatnot, they're actually doing better under learning than they did in person. So we've learned some things that we have to look at carefully when we return to normal learning, if that ever happens. I think that we are going to have to figure out a way to cope with this. We're going to have to figure out new ways of teaching. We're going to have to figure out new ways of existing if we are going to be in this for the long term. And we're not going to be out of the school until they have an effective vaccine or ability to mitigate or control the symptoms of this disease. And those solutions might take a year to 18 months. They might take 5 years, as they have for other types of vaccine. So there's no right now, the way what I'm reading tells me that this disease may be just like the other COVID or the other coronavirus you're familiar with, the common cold. It may just keep coming, and it may just keep hitting you time after time. You'll have some temporary immunity once you immediately get over it. Then you may be back in the soup again and again and again and again every year. And so the question is, how are we going to get out of this? And this is a horrible problem for a million reasons, but I think what we have to do is try to figure out how we can share information from the districts that have had success at this, especially with students who are struggling normally, and let's try to make our state really an example. And I think we can do it. Every school system has its own challenges. There are systems that do not have, as we were fortunate to have, devices in everyone's hands. There are systems that do not have universal access to high-speed internet, which our district has. But you got to understand, our entire region is only 700 and some odd students, grades pre-K through 12. We are a tiny region, and so we have these abilities. But if there's anything that we can share, and our superintendent can share with how we face some of these problems that can help people, I think we'd be only too delighted to do it.
If I may just chime in through the president and on that. So Greg, I would say here to your comments. I think very well said, sir. All emergencies start and end at the local level. We know our communities better than anyone at the state will ever know our communities. Therefore, we are empowered and in the best position to make some of those recommendations that need to be considered. But you're right, there is no cookie cutter one size fits all, which again brings me back to the point where you have to start planning now for the worst case scenarios. If we do open, there should be a plan ready to go. And to Don's point, you've heard Mike Frieda say this on our last call. I've said it many times. Our president is out there echoing and amplifying this as much as possible with Bob Rader and Patrice McCarthy. Now's the time to start doing the planning. Don't wait for the state to tell you what to do, because they're not going to give you every answer. And it's not their role to give you every answer. You should be self-sufficient enough, and you should know your communities enough to start putting those plans together if you haven't already, working with your local recovery officer at the community level, and putting plans together with your towns in partnership and in collaboration to figure out how we're going to pay for what school might look like if we have to open in September. And yes, there's going to be costs associated with it. And now's the time to start having those conversations about what that's going to look like and how to fund it together, not just putting it all on the Board of Education or saying that the town's going to have to foot the whole bill. So there's a lot of work that needs to be done now while we're waiting for guidance from the state. And I think this uncertainty that we're all going through can be used as a unifying force to get towns and boards to start working closer together.
If I may, Leslie Crotty, Chair from Watertown. In regards to starting a plan, I would be very interested in having a CABE meeting dedicated to those districts like Watertown who have already started with their own school reentry advisory council. We've run a scan on one of our 3 frameworks that we've created using the Trigo Ed process. We're in our 2nd week of planning on that, and we use the AEI blueprint and sort of narrowed our plan down into 3 categories. And what we found on each committee, one is health and well-being, one is operations and logistics, and the 3rd is instructional delivery. And we have, area experts on each of those teams. As soon as they started unpacking some of those areas and what school would look like in September, opening and closing and so forth, that it became less overwhelming. And as soon as you break out into those groups and you tackle some of the daily concerns for health and well-being and instruction and so forth, it really becomes clearer that we can do this. It's just going to look a lot different. And I would encourage any district who hasn't started go ahead and do that. But I would love it if we had an update or a check-in with districts that have already started, to help share some of the things that what's worked and what isn't working, and maybe share those resources together.
That's a great idea, and we can certainly go ahead and arrange that, because we know from other meetings we've been part of that there are a number of districts, Stratford comes to mind, that has set up a similar committee structure to try and start doing this work.
So this is John Prince. I'm from Brantford. I fully endorse the positivity that you guys have been mentioning, Greg and Michael. But I do have a question that is more on the dark side, and it has to do with recent information about what the big tech companies are doing with the data that they are accessing with this massive amount of the use of technology. Not so much to kvetch about it, but more so to find out if it's being looked at all on the national level, if it's something that we need to be paying close attention to and advocating for. It's a gold mine for them, from what I understand, and without getting too sinister about it, I think it's something we ought to be aware of.
That's a good point.
Thanks, John.
I wonder if I could just ask something. I wonder if I could, speaking of the dark side, circling back to the graduation thing, the best laid plans of mice and men often go awry. I can't quite say it in the original language, but that's close. What are we going to, has anybody thought what you're going to do when your beautiful drive-in ceremony at the very end, the students all decide to get out of the car, embrace each other, and have a wonderful situation? I mean, what are you going to do? You going to send the police after them? You're not. I mean, the fact of the matter is, when we have when we follow the best, tightest restrictions, we're dealing with human beings, and we're dealing with great kids who are going to be thinking perhaps a little emotionally. That's a very emotional moment for many kids when they graduate from high school. So I think that that's something that also has to go into our planning, or how we're going to deal with the inevitable departures from the plan.
Greg, it's Mike. Let me just take a quick stab at that. And we've put a plan together in Ellington. We're looking at it in Vernon as well. So there has to be those internal controls that Dr. Melchreit talked about, call it in a form of enforcement in some way, shape, or form. It doesn't have to necessarily be law enforcement, but part of our planning at this point is to have people there specifically observing, monitoring, being those internal controls, understanding the guidelines, and helping to gently reinforce, remind people that if they start going outside the guidance or heading in a bad direction, help them back to where they need to be, especially if they're in an emotional state and they might forget. But I think on the front end of it, we have to do even more work to be transparent and clear in our communications about following the guidance strictly, if that's the way the district is going to go for having an in-person or hybrid graduation. So I think it speaks to the point. You've got to be even clearer and more transparent in communicating your plans up front and all together with your town.
This is Megan in Woodstock, albeit we're a smaller community, and our public schools is K to 8, but we do have an 8th grade ceremony, and we've been working very closely with our town hall as well as our town constables. We don't have a town police force, as far as some of those measures, as well as with our Northeast District Department of Health. And I also know Woodstock Academy, which is our designated high school, has been working very closely with the town hall, as well as the constables and possibly the state police, which is our police force up here, because it is a great concern. We have a very large space where people could just decide to gather as they're driving away. But we're also really putting together a lot of communication to go out to our families, in addition to a map with a specific route, exactly how this will happen. And we are, again, it's invaluable to be working with your town hall so they can back you up and support as well.
That's a great point that does keep coming up, and we heard it last week from First Selectman Mike Freda, the cooperation on all of these issues, whether it's about funding or about how you can appropriately honor students in a way that does maintain safety and health.
Hi, this is Sheila. Good
This
afternoon.
is Sheila
This is
McKay. I would
Deborah.
imagine you're going to have your police and fire around that area because it is a community event, so that they would probably be ones to, tap a car and say, okay, move, your turn to file out. But again, you've got your local plans you'll make.
Hi, good afternoon. This is Deborah Kane from the Middletown Board of Ed. What are you all doing for those who are having drive-up graduations when it comes to equity for the students that don't have access to a vehicle to actually drive up to the graduation? How are you all handling that?
Great question. Does anyone have any input? Maybe that's something that we can put out on the board chair listserv and see if we can get you some help with that answer.
Yeah, because, we want people to celebrate, but then, what about the students that don't have access to vehicles? We don't want them to feel ashamed or embarrassed that they cannot participate because they didn't have access to a car. We have to make sure that it is inclusive.
Absolutely.
I'll throw something in there. I think that's an excellent point. We're dealing with it at the local level, municipal level with our testing. We have these drive-through testing clinics popping up everywhere, same concept, ma'am, where there's, what about the people who don't have access to vehicles? So now they're not going to have access to testing. So some of the things that we're looking at, similar to what we're doing with testing, is we have a walk-up testing clinic that we do in the downtown, most heavily populated portions of our town in Vernon. We're also looking at doing something similar, maybe looking at the use of school buses or other types of vehicles where we can help bridge that gap and address any transportation issues. But you got to be creative. We all have to be creative in identifying and addressing those equity issues. We don't have a final plan yet, but as soon as we come up with something, and I'm very interested in hearing what others do as well, I'm totally taking Megan's idea about the map, and we're going to incorporate that in our in all of our communications and our plans out to our parents in the community as well.
Seeing that it's 3 o'clock and we try and honor our commitment to your time, I'd ask you to keep thinking about these issues because we'll pose the same opportunity. We'll provide the same opportunity next week. And with that, I'll turn it back over to Bob.
I'm just going to say have a safe and healthy weekend. Please, if you have suggestions, if you have ideas, please send them to me, Patrice, or any other member of the staff. And with that, I thank you for the hard work you're doing with an issue that you had no idea was going to hit all of us 3 months ago. So thanks again, and we'll see you next week.
Thanks.
Bye.
Thank
Bye,
you.
everybody.
Sheila, check your chat screen from John. Thanks, everybody.
Bye, everybody.
Bye, everyone.
Bye, Debbie Baker. Have a good weekend.